Hi dear friends, welcome back to my channel. Today I will discuss the update for ICD-10 CM in 2024. These updates will be effective from October 1st, 2023. I would like to express my gratitude for taking the time to watch my recent videos. Your viewership is greatly appreciated and I hope you found them both informative and entertaining. If you have any inquiries or suggestions, please do not hesitate to share them with me. Your support means a lot, and I am super excited to continue producing content for your enjoyment and learning in the future. Dear friends, let's start with the update to ICD-10 CM. Compared to last year, there are more updates this year with 395 new codes and 22 revisions. Additionally, there are 25 codes that may appear as deleted, but they have actually been converted to parental codes. The codes themselves have been expanded and now require additional character, so they were not truly deleted. Only few were actually converted to parental codes. Last year there were 1176 new codes and 251 deleted codes and 36 codes converted to parental codes. These changes are not as significant last year. So let's start by discussing the documentation guidelines. Although there have been some changes made, the overall context of the guidelines remains the same. In the past, clinicians who were not the patient's provider were allowed to document certain aspects in the patient record, such as BMI or the stage of pressure ulcer, if it was documented by the wound care nurse. Or however, there has been recent clarification regarding the social determination of health. This year, SDOH codes that are documented by anyone other than the patient's provider are now required to be classified under Chapter 21. This is something that many of us already assume, since SDOH was typically associated with the codes in Chapter 1, but now it is explicitly outlined in the documentation guidelines. Chapter 1, Sepsis due to post-procedural infection. The guidelines for Chapter 1 have been slightly updated. If patient has sepsis following post-procedure wound, we should use a T code for obstetric patients. We should use O code, which take precedence over everything else. The obstetric codes should be sequenced first, followed by an additional code for the sepsis following a procedure T81.44 or sepsis following a procedure O86.04. Screening for COVID-19. A screening guideline has been introduced for the COVID-19 whenever a patient is screened for COVID-19, including preoperative testing. It is essential to assign a code Z1152 per counter. These measures are crucial in ensuring that the patient do not have COVID-19 before undergoing a surgery at the hospital. Myocardial infarction with coronary microvascular dysfunction. The guidelines for Chapter 9 have been updated and new codes have been added for resistant hypertension. We will discuss these new codes when we reach the codes I section. Resistance hypertension is when the patient's blood pressure may remains high despite taking medication. If you encounter this condition, you should use the code I1A.0. However, keep in the mind this code is an additional one and we must first use the specific type of existing hypertension code before adding I1A.0 for resistant hypertension. Coma. There have been some update to the guidelines for coma. It is now clarified that if we know the coma scale or if the patient is medically induced coma or sedated state, we should not use unspecified code. The code R40.20 should only be used when the cause of the coma is unknown or is due to traumatic brain injury and the coma scale is not documented. Additionally, the updated guidelines state that we should not use coma scale code for non-traumatic coma caused by underlying conditions. Therefore, if you are using code R40.2, do not use the coma scale codes. Follow-up. We have a specific code for follow-up procedures which involving monitoring patients after they complete their treatment. For instance, when someone finishes cancer treatment, we use the code Z08 for follow-up examination. If the follow-up examination is for different condition, we use the Z09 code. Now let's get into chapter specific code changes. Chapter 1. In chapter 1, we have two new codes A41.54 and B96.83. These codes represent different type of infection. Bacterial infection. Bacteria are present in the soil and water and they can affect various parts of the body, including the blood, lungs. Sometimes the bacteria can exist in the body without causing harm, but when they become resistant to antibiotic, they can cause a problem. This is known as a carbapenem resistance. Chapter 2. Neoplasm. Family Leishmaniasis polyps is a genetic condition that causes the abnormal cell growth in the gastrointestinal tract, leading to polyps that can turn into the cancer. There are two types with different levels of severity and number of polyps. Mutation can form different types of polyps that may ultimately lead to cancer. New status codes have been added to family history and benign neoplasm of ill-defined sites within the digestive system. D13.99 proper coding is crucial for providing the best care for patients. Chapter 3. Expanded for lot of course with the sickle cell thalassemia. When an individual has sickle cell hemoglobin, their red blood cells may take on a sickle shape when under stress, such as during a period of low oxygen levels. This sickle cell shape may cause blockage in the blood cells, leading to pain and other complications. Beta thalassemia, on the other hand, cause a reduction into the complication production of normal hemoglobin, which can result in anemia. When these two conditions occur together, it results sickle cell thalassemia, and the severity of condition can vary depending on the type. If an individual has beta where no normal hemoglobin is produced, the condition is more severe. If it's beta plus some more hemoglobin is produced, and the symptoms may be milder. And the another codes were added for Shaman Diamond syndrome is another rare genetic disorder that affects the bone marrow, pancreas, skeleton. It weakens the immune system, leading to chronic infection and issue with the pancreatic enzymes. It also often comes with skeletal abnormalities such as short stature. Lastly, there are IgG4 related disease, a complex issue that affect multiple parts of the body. It's an immunomediated condition characterized by the tissue inflammation and elevated levels of certain antibodies, especially IgG4. This disease can target almost any organ, including the pancreas, liver, kidneys, and lungs. Symptoms vary based on the affected area, but often include swelling, nodules, and even organ dysfunction. Chapter 4. This year we have considered number of codes to chapter 4. We have code for endocrine, nutritional and metabolic disease including autosomal dominant hypocalcemia, a genetic disorder affecting calcium metabolism. ADH has two types caused by mutation in either the CSR or GNA11 genes that the body misinterprets low calcium levels, leading to symptoms that affect muscles and the nervous systems and the kidney. Genetic testing confirm the diagnosis and treatment focus on the calcium vitamin D supplementation. However, excessive calcium can lead to kidney issue. So treatment is balancing act. New codes aim to improve tracking and treatment of ADH and other types of hypothyroidism. The Global Leukodystrophy Alliance proposed new code for different leukodystrophies affecting the brain's white matter. Currently, there are only code for six main types, but experts note there are 400. Each has its genetic cause, symptoms, testing, and potential treatment. Unique code for each type will help the research and patient care. There is also new code for metabolic syndrome, which includes high blood pressure, blood sugar, and abdominal fat and abdominal cholesterol level. We have new code for a specific type of insulin resistant and wasting disease, which occurs when a person loses more than 10% of their body weight and the muscles mass due to an underlying chronic disease. Chapter 5. Our chapter 5 course remain unchanged for this year. Means we don't have any changes here. Chapter 6. In chapter 6 we have expanded our leukodystrophy course to include leukodystrophy type that affect the nervous system. Parkinson's disease is now assigned code for both with and without dyskinesia, which is characterized by involuntary and erratic muscle movement. Hypomyelination, which is atrophy of the basal ganglia and cerebellum, is a rare neurological disorder that affects the central nervous system, is assigned to G223.3 code. Lapsopogessive myoclonus epilepsy is a severe inherited neurological disorder that causes seizures and progressive neurological decline. We have created new ICD-10 codes specifically for chronic migraine with aura. Chronic migraine is a defined having a headache occurring 15 or more days a month over a 3-month period, with at least 8 days a month featuring migraine symptoms. These new codes aim to provide more coding specificity for the treatment and research of individuals suffering from chronic migraine with aura. Chapter 7. In Chapter 7, the American Academy of Ophthalmology proposed new code for proliferative sickle cell retinopathy, a condition that can lead to vision impairment and blindness. Additionally, there are new code for muscle entrapment, a condition more commonly found in the pediatric trauma but rare in the adults. This condition can lead to severe symptoms such as bradycardia, nausea, syncope. The American Academy of Ophthalmology and the American Association of Oral and Maxillofacial Surgeons support the proposed code as they aim to provide better research for treatment, especially since the condition required urgent intervention to the prevent muscle necrosis. The proposal recommends adding unspecified to the subcategory of the age for more accurate coding. Furthermore, there are codes addition for low vision of the right eye category and the foreign body sensation of the eye. We will discuss the foreign body codes further in the future. Chapter 8. Have been no changes made to Chapter 8. Chapter 9. Chapter 9. The most recent updates to Chapter 9 includes the addition of 10 new codes, including I1A.0, which refers to resistant hypertension. This type of high blood pressures persists even after trying at least 3 different antihypertensive medications. The new codes also address coronary microvascular dysfunctions, which affect the small blood vessels in the heart and cause symptoms ranging from angina to heart failure. As we know, coronary microvascular dysfunction is associated with a higher risk of major cardiac events. In the 2021 guidelines for diagnosing chest pain recommend specific tests for its detection. These new codes were proposed by Abbott Laboratories to enhance diagnosis and treatment. One of the modifications is the code little for inappropriate sinus tachycardia, which is now I47.11, with the added statement so stated. To keep up with these changes, it is important to update all quick pick lists and super bills. Another new code added I47.19 has been added for other SV tachycardia, supraventricular tachycardia, while an unspecified code remain available. If the provider only state SV tachycardia, then we need to assign I47.19. Chapter 10. Chapter 10 for Acinetobacter has undergone changes based on the internal CDC review. As a result, new codes have been introduced in Chapter 10 to reflect these changes. In addition, updates have been made to bronchitis and COPD, including the addition of an other specified COPD codes J44.89 and the inclusion of allograft related lung disease such as restrictive allograft syndrome J4A.8 and the chronic lung allograft dysfunction J48.9 unspecified. Chapter 11. This year we have expanded our collection of codes that pertain to digestive system. Acute appendicitis with generalized peritonitis is now available, as are code for abscess with or without it. We also included a section on small intestinal bacterial overgrowth, which can produce symptoms like bloating and abdominal pain. Typically, diagnosis is performed via breath test or intestinal samples, and treatment options may include targeted antibiotics or antifungals. These conditions have become increasingly worrisome for patients' quality of life. In addition, we have added some retroperitoneal codes like retroperitoneal hematoma and retroperitoneal fibrosis. Lastly, we have introduced new codes for short bowel syndrome with or without colon incontinuity unspecified one, and one code for the intestinal failure. Chapter 12. Chapter 12 remain unchanged, means we don't have any addition or deletion here. Chapter 13. Revise. There is a need for updated codes pertaining to orthopedic procedure utilizing autologous bone graft in the osteoporotic patients. The current code failed to provide accurate characterization of pathological fracture of pelvis, which can adversely affect clinical decision making. Proposed codes would include age-related osteoporosis with the concurrent pathological fracture of the pelvis, leading to more precise diagnosis and treatment. Chapter 14. Chapter 14 of our medical codes includes new codes for the immunoglobulin nephropathy, a kidney disease that commonly affects young adults and can lead to end-stage renal disease. These addition codes provide greater specificity and allow to better patient care. Additionally, we have included codes for the specifying different types and the specification of the nephropathy. Chapter 15. As we know, Chapter 15 takes precedence over all other codes and must be accurate. Recently, the obstetrician and gynecologist section added a new code for intrahepatic cholestasis in pregnancy, a liver disorder that affects around 0.5% of pregnancies and poses risk to both mother and baby. Diagnosis is done through the bile duct blood test and there are established treatment guidelines. This condition usually resolves after pregnancy but may indicate future liver disease. Chapter 16. In Chapter 16, we don't have any update. Chapter 17. In chapter 17, we discuss updates regarding congenital malformation, deformation, and abnormalities. One such condition is Alagille syndrome, which is a genetic disorder that can cause jaundice, poor weight gain, and heart defect. It is currently categorized under broader liver malformation code, which is important for improving patient care, clinical practice, and patient education and research. This proposal was put forth by the Global Liver Institute. Additionally, we added new specification for the craniosynostosis, which occurs when the baby's joints, skull bones close too early, affecting the skull shape and brain growth. Treatment usually involves surgery to correct the skull shape and allow for proper brain growth. Another disorder we discuss is MED13L syndrome, which affects over a million people worldwide, and it is characterized by intellectual disability, heart defects, and the low muscle tone. The foundation advocating for this syndrome push for new code. Although this disorder is managed through various therapies and ongoing surveillance, there is currently no cure available. Finally, we added code for the Phelan-McDermid syndrome, Body-Bettel syndrome, and Lawrence-Moon syndrome. Chapter 18. This year we have introduced many codes for foreign bodies entering through orifice. We will discuss these in our external cause codes. However, we also have codes for the situation where we feel like there is a foreign body present but there isn't one. These codes are included in our chapter 18 and are specific to sensation of foreign bodies in the nose, throat, and other areas. We have also added a new code for non-traumatic coma, which we discuss in our documentation guidelines. Additionally, we have included several new codes for the density of breast. This is important as dense breast can affect mammogram reading. The combined codes allow us to specify the patient breast density when the come for mammogram, which improves the accuracy of data. When it comes to breast code, it is crucial to define the laterality as right, left, or bilateral. Chapter 19. We have some new codes related to the toxic effects of gadolinium, a chemical element used in various MRIs. It can cause side effects like discomfort at the injection site, nausea, itching, rash, headache, and the dizziness. However, there are also some less common side effects such as nephrogenic systemic fibrosis. Chapter 20. This year we observed significant alteration in the chapter 20 which pertains to external cause code concerning death, dying, and child safety. This includes items like water beads, aqua beads that can expand and pose a danger when ingested by a child, as well as the magnet and small button batteries. Ingested button batteries can cause rapid health issues. Button batteries are more likely to be accidentally ingested than the cylinder batteries. Has been expansion of codes that push for more safety in these cases. Majority of codes are added for little kids sticking metal objects, magnets, pieces of plastic toys, jewelry, and so forth into their ears, nose, and mouth, so forth. So you can see we have different types of objects here that can be inserted or entered into the throat natural orifice. Batteries, plastic coins, plastic beads, jewelry bottles, glass, magnetic metal objects, metal jewelry, and non-magnetic metal beads, metal toys, bezoar, which is like a clump of hair or natural fiber, and then we have food rubber, bands, combination of metal, plastic, and the needles, then knife, sword, or dagger entering into the natural orifice. Chapter 21. In Chapter 21, there are a number of newly codes added. These codes include child welfare exam, observation, evolution of newborns who have been cleared for suspected conditions, and code Z16.13, which indicates resistance to carbapenem. Additionally, new status code added, which is carrier of carbapenem, can be found in the series of new Z22 codes. Other new codes added include those for the encounter related to HIV, pre exposure, other prophylactic measures, and new codes that already we discussed about SDOH code for children in the custody of non parental relatives or non relatives guardian. These SDOH codes offer a lot of new options. Chapter 22. This is remain unchanged. Revised codes. Here are the updated codes. The old description is on the right hand column and the new description is on the left hand column. Most of the changes were minor. For example, say metabolic acidemia unspecified has been changed to metabolic acidemia in the new one. Converted to parental code. We have added additional character to certain codes such as those for the hypothyroidism, other form of angina pectoris, Parkinson's disease, metabolic syndrome, and the insulin resistance. These expansions allow for more specific coding but does not remove any existing codes. So next is chapter-wise distribution of codes. Here are the updates for the specific chapter in 2024 updates. This is a summary of ICD-10 CM. Dear friends, I have done my best to provide all the necessary information and I hope you have understood everything today that has been covered. If you have any further questions, please don't hesitate to ask in the comment section. Additionally, if you are interested in using this presentation for educational purpose in your workplace, please provide your email address and I will send it to you. Thank you so much for watching my video.